I think she's going to ask, and other people may be interested. It seems like we're talking about primarily uncertainty and not, and her son being sick, and it happens to be about throwing up, but it could be basically about any other illness. So, how does what she experienced compare to emetophobia, like actually fearing vomiting, as I understand it?
So sometimes people who, I mean, when someone has a fear of vomiting, it doesn't necessarily mean they have a fear that they're going to die from it. Most people don't, but some people do. I remember I'm working with a patient right now who developed emetophobia because as a child, his mom had cancer, and she was going through chemo, and she was doing a lot of throwing up, and then a couple years later she died, and so he associates throwing up with death. So for him, he does think of death, and other people do too. But oftentimes people with emetophobia don't think about death. They just think it's disgusting, it's horrific, and they associate. Oftentimes, there's an association with panic. So not only are they experiencing nausea, but they're feeling extremely anxious. So the average person, when they feel nauseous, they don't want to feel nauseous and they don't want to throw up, but they don't tend to be anxious. But anytime someone with emetophobia feels nauseous, or they have loose stools, or they have some sort of physical symptom, anxiety is right there with it. And so there then becomes a pattern of safety behaviors and avoidance where they stop eating. And then because if there's nothing in their body, there's nothing to throw up. So they'll stop eating. And then they get hunger pains. And the hunger pains then are misinterpreted as, oh no, I'm going to throw up. I'm feeling something in my stomach. And they further don't eat, which, compounds the problem. So, yeah, I'm not sure if I answered your question.
No, it's okay. Yeah, so I can see that that's kind of a different fear altogether than what Danielle's experiencing.
Yeah, because for Danielle, it might not just be him throwing up. It might be any sort of sickness that he has, but it could be both. I mean, you could have the emetophobia as well as the fear of him dying. I mean, absolutely.
And so if someone maybe doesn't stop eating because of fear of vomiting, but just in general is worried about that all the time, do you actually suggest that they, for instance, try to get themselves to throw up or eat something that they know is going to make them nauseous? Like, what kind of exposures would somebody with the fear of vomiting do?
Yeah, good question. So I do not recommend they stick their finger down their throat or drink Ipecac or anything like that. You don't have to overcome emetophobia by doing that. I think it can be dangerous, and it's not something that I recommend. But there's plenty of other exposures that you can do, and you need to do all the other ones. And those exposures really depend on where your fear lies. And it could be as simple as, for some people, just saying the word vomit will cause anxiety. So for them, they just need to start saying words like vomit and barf and puke and all these things out loud in their home, away from their home, while they're eating. There's a ton of exposures. And everything, if you have more of a fear of germs and food poisoning, it would be maybe eat something one day after the expiration date. But again, for someone with emetophobia, that may just be too much. So in that case, they're going to start off maybe by eating one bite of something the day before the expiration date. I've had patients who have a fear of food not being digested. And so after they eat, they won't leave their house for 2 hours until their food is digested. So working with a woman right now who will not drive after she eats for a couple hours. And so I said, well, why don't you just, eat a meal and then drive a block? But that was too intense for her. So literally it was taking one bite and then sitting in her car that was it. That was enough just to start with. And then having one bite and driving 10 feet. and then it was, now she's at a point where she can eat a meal and drive, I think, like in her neighborhood. So she's getting a lot better with that.
Yeah, one thing I just want to comment on while you're saying that is that the exposures are process driven, not outcome driven. So in that case, the reason that we want, like, it's great to do the smallest next step is because you want to meet your anxiety where it is and do whatever your body can tolerate in terms of getting anxiety going and then showing yourself you can handle it. So you wouldn't want to do the scariest thing you can think of, and which can potentially be traumatic to you. You want to do the next step and then get good at that and then move forward to the next hardest step.
Right. You don't want to do anything too difficult because that could trigger panic and be regressive. So I always tell people to start off creating some anxiety to practice responding differently to it. It's not just doing the exposure, it's doing it correctly. So in the Metaphobia manual, I talk a lot about how to do exposures correctly with the correct mindset. So you can practice responding differently when you do feel anxious. Yeah, so you want to have an offensive mindset, and the whole idea is to practice responding in a different way. So, for instance, one of the exposures that I'll have people do is make, and again, we're starting out small, is making vomiting noises, the sound of vomit. And then spitting into a sink, just putting water in your mouth and just spitting. And then putting water in your mouth and then spitting into the sink, making noises, increasing the realism of those noises. And then moving on to other liquids and moving on to the toilet and things like that. But when people do these, people are terrified to do these exposures. If you have emetophobia, it's pretty terrifying to do it. So you want to do it in the right way, which is sort of a bring it on mindset. And I talk a lot about this in the book, to want what you don't want. Like, all right, bring on the nausea. I can handle it. And what people find is when they do that, there's a lot of anticipatory anxiety, but in the end, they're like, oh, well, that wasn't so bad. Actually feels pretty good. Like they find that it feels more empowering and when they do it the correct way. And the patients that I work with who have emetophobia find that doing those kinds of exposures are extremely helpful, and that they really just stop fearing it. So they don't have to stick their finger down their throat. They just have to pretend to puke.
Okay. And then what about if somebody has sensitivity to gagging and kind of is afraid of anything that might make them feel disgusted because they might gag?
So they're not afraid to throw up. They might gag.
Yeah.
And then do they gag? So if they gag, if they do gag, yeah. Usually when people have that, they don't want to gag. And unlike someone with emetophobia who does not throw up, typically people with emetophobia never throw up. They can go 10 years without throwing up, but they still fear it every single day. But people with a fear of gagging often do gag. Like that's one of the symptoms of anxiety is it triggers a reflexive reaction to gag. Whereas someone with emetophobia, they feel nauseous, but they don't throw up. So with the gagging, you have to, it's very hard, but you have to stop trying to control it, and you actually have to be okay with gagging. So much so that you have to sort of accept it to the point where, all right, if I gag, I gag. So by reducing the fear of gagging, you're going to actually reduce the likelihood that you're going to gag, because it's sort of self-perpetuating where you fear gagging so much that you end up gagging. But if you stop caring about gagging, then you're going to gag a lot less. It'll just be, you still might, but the frequency will be a lot less. But when you try to stop the gagging or become afraid of it, then it's just going to happen all the time. So you purposely gag, like just, you're going to go places where you might gag and say, all right, if I gag, I gag. And you see, and then you're going to work with the therapist who specializes in anxiety to see where to go from there. But it's very similar to other symptoms of anxiety, like racing heart or blushing or lightheadedness. You can't stop that. So instead you have to accept it. You just have to accept that those symptoms are going to exist and learn not to be afraid of those symptoms and to let them happen.
That is really
and really get to the root of it, because usually the people who have a fear of lightheadedness are a fear of passing out. People who get nauseous are a fear of vomiting. The fear of gagging, I don't know. I guess you have to find out, is it a fear that they're going to die? Is it a fear of embarrassment?
What I'm thinking of is in the context of social anxiety. Yeah.
Yeah, that they're going to be very embarrassed. Yeah, it's very, very difficult to do that. I did work with someone who had that, and he actually gagged, and he finally sought out treatment because he was doing law school interviews and he couldn't go to these interviews. And he would use safety behaviors. He would eat things to prevent the gagging, but he can't eat in the middle of an interview for law school. So he had to be okay with gagging.
Yeah, so just to comment on that, safety behaviors are things that people do to try to prevent themselves from feeling anxious. And so when you're thinking about what kind of exposures you'd want to be doing, you're also looking for in what ways are you doing safety behaviors and refraining from doing the things that typically prevent you from feeling anxious, because they're going to then make you feel anxious, but then you're going to practice tolerating that uncertainty and that anxiety.
Right. So it's leaving the house without the mints or whatever you take with you to prevent yourself from gagging. Or oftentimes people with emetophobia will take water with them, or there's a lot of things they might take with them. So it's learning how to go out without those. And again, you're doing it in small steps.
Yeah, all of that makes sense. Was there anything else any other impressions that you were hoping to talk about?
No, I think we covered a lot of it. She just has to maybe come up with a mantra and sort of get it into her head. Maybe for her, it would be something like, I will not exaggerate risk and I will not underestimate my abilities. And just say it all day long. So it gets in her head. So put it as a reminder on her phone, because she's just underestimating her abilities. I mean, that's not the only problem, but that's a piece of the puzzle. Because when it comes down to it, when her son has a problem, she'll be able to deal with it.
That sounds great. I totally agree. Thank you for your time.
All right. Thank you.